welcome to GDC classes English. So today we are back with our Telangana Pharmacist exam question paper with its answer key, right? So today we are going to discuss all the questions. So I hope you all have answered it correctly. You all have definitely got the materials, you have accessed the study material, you have seen the model papers, you have used the fingertips book. So if that has happened, then there is no point that any question will be incorrect. Just in case, I still want to see your everybody's responses in the chat box, comments box below, right? Any question you have in mind, any responses, how many have you attempted? We really need your responses in the chat box, right, or in the comments below, so you can get a better idea of how much you have secured, right? So let's begin with the question number 1. Okay, so the question number 1 actually says, in which year? Question number 1 says, in which year 9th edition of Indian Pharmacopoeia was published? In which year 9th edition of the Indian Pharmacopoeia was actually published? So this is a very simple question that I hope you all have got it right. So the first edition was actually in the year 1955 it was published. The second was published in the 66, third was published in the 85, fourth was published in the 1996, fifth was published in 2007, right? Sixth was published in 2010, eighth was published in, seventh was actually published in 2014, your eighth was published in 2018, and your ninth was published in 2022. So I hope you all have got the answer right. There was no confusion. It was such a direct question, right? So we have our first, second, third, fourth, fifth, sixth, seventh, eighth, and finally our 9th edition of Indian Pharmacopoeia. I hope this was not a difficult question for you all, right? Next question, again very direct question. Question says, the major component of the glass is, students, I hope this was not a problem for you all to see that it will be nothing but your option B, silica, right? We have boric acid, we have sodium oxide, we have calcium carbonate, but yes, the correct answer was your option B, silica, right? Yes. So next question. Says blending of explosive material. Next question says blending of the explosive material is done using which type of mill? So you have the option of the edge runner mill, which directly goes out of options, the blend mill. See, you have the explosive material. So none other than your rubber mill will be the correct answer. Although we had two more options here, edge runner mill, blender mill, end runner mill, and the rubber ball mill. So the correct answer for the explosive material will be your direct answer, that is your rubber ball mill. Okay, so next question states the rate of evaporation is. Next question states rate of evaporation. Rate of evaporation, students, in the minor classes even you know that rate of evaporation is directly proportional to the temperature. Rate of evaporation is directly proportional to the surface area. Rate of evaporation is directly proportional to the wind speed, but the rate of evaporation is inversely proportional to your humidity. So in this question you can see correct answer will be directly proportional to the temperature of the liquid, right? The other option says directly proportional to the humidity. No, we have just seen it is inversely proportional to the humidity. Independent of temperature. No, it is directly related to the temperature. Inversely proportional to the temperature. No, it is nothing but your directly related to the temperature. It was such a simple question. So, rate of evaporation is actually directly proportional to the change in temperature, right? So, next question, students. Next question is right below. Okay. So, next question states, calculate the child dose. Calculate the child dose if the age of the child is 5 years, right? And the adult dose is your 600 mg. So let's not even look at the formulas. Let's just directly calculate it. Age of the child is 5 years. So here we will apply our Dilling's formula, which states that age of the child will be 5 years upon you will have 20 into your average adult dose, right? So just by merely solving it, you get the correct answer as 150. Tell me how many you have got it right. As per the Dilling's formula, you have the age of the child written here. You have the average adult dose that was mentioned in the question. So none other than 150 mg is your correct answer. I hope you all have marked it right. So the correct answer is option number C, 150 milligrams, right? Next question, directly based out of your Latin terms, which says, what does this Latin term omni main means? What does this Latin term omni main means? Now, if you have been a regularly basic knowledge having student, this main actually means your morning. So the question should have no confusion, but the only confusion was that early in the morning or every morning. So it will omni means every, right? So correct answer was option B, every morning. For night it is omni nocte, which is every night, right? So we have correct answer as option B. Okay. Next question. Which of the following statements is correct regarding the immunological products? Now, immunological products, very simple options they have given. Let's read it from bottom to top. They say they are not used in the disease prevention. Then why they are used? Definitely incorrect option. They only contain synthetic components. This is definitely incorrect. They provide immediate protection. Not at all. Not at all. This should have not been any confusion with. They stimulate the immune system. Right? So, correct answer should be option number C. Okay. Next question is based out of the defects on the tablet. Question says uneven distribution of the color on the surface of tablet. Unequal distribution of the color on the surface of tablet. Question says that we have 4 options. Lamination. No, lamination is what? It is nothing but the separation of the tablet into layers, right? Picking. No, in the picking generally your tablet adheres to each other, right? It gets glued anyways. Capping, no, the separation of cap, partial or complete separation of the top and bottom of the tablet. So the correct answer for the unequal distribution of color will be none other than your mottling. Okay. Next question. The particles in a pharmaceutical suspension should have which of the following property? Direct question, students. This is a very, very simple question to ask. Which should be your dispersed particles in pharmaceutical suspension, which must be the following property? Particles should dissolve completely in the medium. No, suspensions are heterogeneous in nature, right? Option B, particles should remain uniformly suspended without the need of shaking. No. In these suspensions, there is always a label shake well before you. So these options are not possible. Let's see what other options do we have. So we had 2 more options here, which mentions the particles should settle down slowly and should be easily redispersed on shaking. Very correct answer, right? So the correct answer will be none other than your option number C. Okay. Now let's move on to the next question. We'll be quick. We'll be doing our first 40 question here. We'll be very quick with it. So freeze drying, that is lyophilization, is used in the vaccine preparation primarily for their removing impurities. Have you ever heard that freeze drying is used for removing the impurities? For boosting the immunogenicity? Not at all. The freeze drying has nothing to do with that. Inactivate the pathogen? No. These are not the level of responses that the freeze drying can provide. But yes, it can definitely help you to increase the shelf life of the product, and that may add up to the ease of the storage. So there should not be a problem here. Correct answer will be your option number A. Okay. Next question. Question says, there is little bit formatting up and down. So I hope there is not a problem. You are able to read the questions and the answers which follow. Which portion of the nephron extends into the medulla? Question says, which portion of the nephron extends into the medulla? So in the nephron you have seen there is one only portion out of which your nephrons are based on the cortical nephrons or the juxtaglomerular nephrons, in which none other than your loop of Henle actually extends into the medulla. So there should not be any confusion if you just have the basic knowledge of the patho, right, and the basic knowledge of the nephron. You should see that only loop of Henle is able to get to the medulla portion, right. Next question says, which should be the correct pathway of air into the lungs? I at least hope this was not a problem, right. Firstly, when we inhale the air, we inhale it through our nose. So yes, the first option could have been correct. Then it goes on to your tracheal portion. Which reduces the chances of option B and D. Okay. Then inside the lungs, they divide into your bronchi, which further divides into branches that are bronchioles, right? That further leads into sac-like structures which are called as alveoli. So by now it must be clear that yes, nose, then trachea, then bronchi, bronchioles, and then we have the alveoli. Okay, so this was very simple question. So correct answer was option number 3. Okay, moving on. The part of the brain that controls function like heart rate, breathing is called as dash. So if you have seen in the brain, we have various parts. Majorly we are talking about the hindbrain, which actually controls up your functions that are heart rate and breathing, and to which is the most important part we have is the medulla oblongata, right? So medulla oblongata actually controls your heart rate. Okay. Next question. Which neurotransmitter, all the ecology lovers, please come up. Which neurotransmitter is released at the preganglionic fiber of the parasympathetic nervous system? So, if you know your neuron, we have seen this, your neuron is divided as your presympathetic and your postsympathetic. Even that, before that, let's see, we have the parasympathetic system and we have the sympathetic system. Right? In the parasympathetic system, we have preganglionic fibers and postganglionic fibers. We have preganglionic fibers and postganglionic fibers. So, both of these actually release your acetylcholine. Both of these are responsible for releasing the acetylcholine. While in the case of sympathetic, here also we have the preganglionic and postganglionic. Preganglionic is responsible for the acetylcholine, while the postganglionic is responsible for the epinephrine, norepinephrine, like that. So I think the explanation itself will give you the answer. neurotransmitter released at the preganglionic site of the parasympathetic. That is none other than your acetylcholine. So let's see what were the options. We have epinephrine, no. We have seen in the postganglionic part. Dopamine, no. Norepinephrine, no. Correct answer will be option D, acetylcholine. We have just seen that what are the basic types and how we classify as per our hormones that are released. Okay, next question, students. The question says, which of the following cells make up the gastric glands in the stomach? So you know, in the stomach we have some briefly we have 4 types of cells. Number 1 will be your mucus cells, right? Number 2 will be your parietal cells. Number 3 will be your zymogen cells, right? And number 4 is going to be your endocrine cell. Here you have to find the best combination, so none other than your zymogen cells along with the parietal cells. So zymogen cells are nothing but they release your proenzymes, for example your zymogen, right, pepsinogen, right, which needs to be activated so that it converts to pepsin for the digestion of the proteins. Okay, next question. The hormone that is produced by placenta rescues corpus luteum from degeneration until 3rd and 4th week. Any student who has a basic knowledge of the pregnancy hormones would have been able to answer this question. Any student with a very basic knowledge of the pregnancy hormones, which include your HCl and one more hormone that is very common, that is your HPL, right? HCl is none other than your human chorionic gonadotropin. HCG, not HCl, so sorry. HCG, human chorionic gonadotropin, and HPL, which is your hormone placental, your I think lactogen or something it is there. I am not sure about the full form. So it's HCG and HPL. These are the pregnancy hormones. The correct answer is option number B. Okay. Moving on. The muscle present in the backbone and the humerus bone brings about the movement in the pectoralis major, your bicep tricep, or your latissimus major, right? Yes, whatever is the option, let's focus on what the question says. So let's see the muscle present between backbone and humerus. Now you know backbone and humerus we are talking about. We are already talking about the backbone portion. So in that case, these two options are almost eliminated, right? However, this muscle, pectoralis major, actually connects your chest wall to your upper arms, including your shoulders. So the correct answer we left is option number 4. Okay. Next question. Which protein filaments are responsible for the muscle contraction? Now, if you have a basic understanding of the muscle physiology, you know that nothing but your actin and myosin filaments, none other than your actin and myosin filaments are responsible for the movement of your muscles, right? So, these actin have the binding sites that will allow the myosin to attach, and then they come in their action and undergo the muscle contraction. So first option was your actin and myosin. Second option was your myosin and troponin. Third option was your collagen and elastin. Fourth option was your tropomyosin and collagen. So just now we have seen the correct answer will be your number 1, actin and myosin. Okay. Next question. Disease that persists. Question says disease that persists for a prolonged long period of time. So if we call them for a shorter period of time, then it will be known as your acute diseases. But very simply, if they are, it is mentioned that if these are persisting for a long period of time, they will be known as your chronic diseases. These are very basic questions, Very basic questions. I hope these were not an issue for you all to attempt, right? Next question. In the third stage of demographic cycle, question says, in the third stage of the demographic cycle, there is an increase in the population as option A, decline in death rates while the birth rates remain unchanged. Option B, birth rate exceed the death rate. Option C, high birth rate cancels the death rate, which is, I think by reading you know it is not possible. Option D, birth rate is lower than the death rate. So generally it is divided in your 5 stages. If we talk about the demographic cycle, it is divided into your 5 stages. In the first and second stage, we have higher birth rate and higher death rate. We have high birth rate and high death rate. Okay. In the third stage, in which the question has asked, generally your birth rate exceeds the death rate. Your birth rate exceeds the death rate, right? So we have a higher birth rate which will exceed the death rate in the stage 3. In the stage 4, we call it as a stationary phase, whereby we have declining. We call it as a stationary phase. Why? Because we have a declining birth rate and low death rate. We have a declining birth rate and low death rate. In the stage 5, we have both declining. In the stage 5, we have both declining. So none other than your option number B, which states birth rate exceeds the death rate, will be your correct answer to the question. Okay. Next question. Which of the following acts as a long-acting reversible contraceptive method? So you know, long-acting contraceptive method out of a combined pill, vasectomy, which is a surgical method, not possible. You can see reversible, it is written here. However, the surgeries are not very much reversible. Male condoms, barrier methods are not reversible. The pill action is not reversible. So we are only left with the intrauterine devices, option C, which includes all of your, I think, properties and all. They are included in the intrauterine devices. We have hormonal IUDs as well. So correct answer will be option number 3. Okay. Next question. Cardiopulmonary resuscitation is not performed in the case where heart stops beating. No, in that case we do it. In the case of drowning, no, you have seen this is actually done. In the case of terminal illness, when you have seen the patient is no longer responding, in that case generally it is not done. It was a very basic question, right? In the unconscious state as well, no, it is not done. Next question. 𝘂𝙎staining technique is used for identifying. So if you know, the 𝘂𝙎staining is actually for identifying the acid-fast bacteria belonging to the class of your Mycobacterium. So correct answer will be option number B, Mycobacterium. I hope this was not a difficult question to deal with. Okay. Next question. Whooping cough. Whooping cough is caused by. Whooping cough is caused by. Students, at least this type of questions are expected for you to answer very directly. Even after looking at the responses. Yes. So even after not looking at the responses, we know the correct answer will be Bordetella pertussis. Let's see the option. The first one, very direct, we have is the Bordetella pertussis. I think it does not even need any discussion. It is such a common bacteria to use, right, in the case of the whooping cough. So next, transmission of the diphtheria occurs through. Now, if you have any knowledge of diphtheria, you should understand that it is a bacterial disease which affects the upper respiratory part. So mosquito bite, not a chance, right? Infected people, body fluid, not a chance. Cough or sneeze, because it spreads through the bacteria that affects your upper respiratory part. So we have the correct answer as option number 2. Next question. In emergency, what should be the first step in treating the shock? So, in emergency generally, will you start administering the medication? No, wrong answer. Will you apply cold compresses or apply splint to the affected areas? No. What we do, we ensure the patient is in the lying down position with the elevated legs. Why? So as to ensure the uniform blood flow all across the body. So the correct answer is option number 2. Okay. Next question. Carmustine belongs to the chemical class. Question says carmustine belongs to the which chemical class? Now you know carmustine is what? It is an alkylating agent. Carmustine is what? It is an alkylating agent for various malignancies, which belongs to the class option A, nitrosoureas. Basic pharmacology people, come here. Nitrosoureas, very direct question. This should not be incorrect from your end. Is it a hormone? No. Is it an ethylamine derivative? Some spelling is wrong. Or polypeptide antibiotic? Not at all. It is nothing but here belongs to the nitrosoureas. Okay. Next question. Which of the following is used as an antibiotic for cyanide poisoning? I really want you to guess the answer here. We all have 3 options here and one on the next page. You can see aluminium hydroxide, potassium chloride, zinc sulfate. Always and always when we talk about the cyanide poisoning, none other than your thiosulfate, especially your sodium thiosulfate, is used in the case of the cyanide poisoning. Okay. Next question. Basic nucleus present in the tetracycline ring. Students, now even if you do not know the nomenclature, you just know that tetracycline from the name that it has 4 rings. Right? If you remember, tetracycline has 4 rings in the structure. In any of the option that tetra is not mentioned, it is very evident that your correct answer will be option number 1. Because you can see basic nucleus, it's very evident only this class which has your 4 rings attached one with each other. Okay. Next, barium sulfate is used in the medical imaging for. So medical imaging generally has the diagnostic purposes, right? So in the options we have the X-rays of the gastrointestinal tract, which is for the diagnostic purposes. We have the correct answer already. ECG, no. Have you ever seen? We have used in the ECG, no. In the laparoscopy, no. In the cytoscopy, no. Correct answer for the diagnostic feature, the X-rays of the intestinal tract, whereby the barium sulfate is used for the imaging, right? Next question. Which of the following reagent is used for the limit test of arsenic, right? Now, if you know limit test of arsenic, now if you have any knowledge of the limit test of the arsenic, you would have answered. You have seen while in the limit test, it is actually based on the reaction of the arsenic gas and the mercury chloride, due to which we will get the yellow-brown spots on the paper after the reaction. But in the test solution, your stannous acid, your iodine and zinc dust are added. So in neither option 1, neither option 2 it is mentioned. But let's see 3rd and 4th option. Yes, in the 4th option you see stannous chloride, potassium iodide and zinc. This is the correct answer. Okay. Yet again, my dear pharmacology students, come here and look at the next question. Very much direct. Sulfonamides are the structural analogues of. Sulfonamides are the structural analogues of nothing but your para-amino benzoic acid, right? So these are the structural analogues of PABA, para-amino benzoic acid, used in the case of the folic acid synthesis. Okay. Next question we have, which drug corresponds to? Students, this is very important. Although in a lot of your pharmacist exam, this question revolves around the indomethacin only, whereby you can see the drug that corresponds to the chemical name. By just looking at the indole 3-acetic acid, my dear chemistry students would have guessed it, and all other students who have prepared well for the exam and have a basic knowledge, that correct answer was your indomethacin. Okay, don't even look at other options. You can just by looking indole here, you can see indomethacin was a definite choice. Next question. 𝘿𝙬𝙎𝙐 is a first generation antipsychotic that belongs to the class of what? Now if you remember, in the antipsychotic class, in the antipsychotics we have typical antipsychotics and we have certain atypical antipsychotics. We have typical antipsychotics and we have atypical antipsychotics. In the typical antipsychotics, we have phenothiazine derivatives and we have the butyrofenones. In the butyrofenone, students, we have nothing but your 𝘿𝙬𝙎𝙐. So that is why in the butyrofenones, your 𝘿𝙬𝙎𝙐 belongs to the class of your butyrofenones. Okay. What were the other options? Phenothiazines, no, just told you. Your dibenzothiazide, no. Your thiothiazine, no. So, here in the atypical, correct answer will be your option number 1. Okay. Next question. The interaction between two drugs in which one of that enhances the effect of the other is called as, in which one of that actually enhances the effect of the other is known as option A, antagonism. Option B was your synergism. So if you know the synergistic effects are as a result of the drugs that actually are motivated to enhance one of the effect. For example, if I say so, we have certain anti-cancer drugs which are actually blocked, which their efficacy actually is reduced by the PGP, which is the efflux transporter. So when we administer the anti-cancer drug along with the PGP inhibitors, it is going to help with the multi-drug resistance. So that is why in the case of synergism, the interaction of two drugs whereby one enhances the effect of the other is called as nothing but your synergism. Okay. Next question. Which of the following is a potent narcotic analgesic? Papaverine, naltrexone, morphine, naloxone. Students, please see, other than the correct answer, you should have guessed it. They are nothing but your opioid antagonist, right? And the question is asked you about the potent narcotic analgesics, right? In the question you see that it was mentioned to answer potent narcotic analgesics, but all others are your antagonists, but we have the correct answer of the morphine. Okay. Next question, we are closing the we are close to the end. So what is the primary use of the barbiturates? Is it antiemetic? Not at all, right? Option B, are these antidepressant? Primary role they are asking, are these antiarrhythmic or they are used as sedatives and hypnotics? In the whole chapter of sedative and hypnotics, we just talk about the barbiturates. It is so simple, basic classification you get it from, right? Next question, which of the following statements is wrong regarding, false regarding the adverse effect of local anesthetic? Read the question again. Which of the following is incorrect or false regarding the adverse effect of the local anesthetic? Option A, hypersensitivity reactions are more common. It is a local anesthetic. There is no chance that there is going to be such hypersensitivity other than mild rash or something. Bupivacaine has the highest local tissue irritancy. No, it is a local anesthetic. Why irritancy? Incorrect. Cardiovascular toxicity is manifested using, not at all, it's a local anesthetic. What we are talking about? So correct answer will be option B. Cross reactivity will be observed with the amide linked local anesthetic than the ester compounds. Even if you have very basic mindset about pharmacology, this was not a difficult question, students. Next, which again similar concept, which of the following is a beta adrenergic antagonist? You can see all other are your agonists despite the correct answer, but your antagonist, all containing drugs, are your beta adrenergic blocker drugs. Okay. Last question. The following drug is a selected alpha-1 agonist used for decongestant as well as mydriatic. So you spot that decongestant as well as mydriatic. So in that combination, never ephedrine is used, neither amphetamine is used, but your phenylephrine is used. So correct answer will be your phenylephrine, and your wrong answers corresponds to the ephedrine, your amphetamine, and your timolol. Okay. So this was all about today's session. I hope you have got the answers, majority of the answers right. I am waiting for your responses. Do let me know in the chat box below, in the comments below. Thank you so much. If you have any doubt, any feedback, you can comment down. Okay, thank you so much.